All right, so today, we're not just going to talk about a disease. I want to tell you a story. It's a story about knowledge, it's about empowerment, and honestly, it's one of modern medicine's biggest success stories. We're talking about testicular cancer. Let's dive in.
So here's our game plan. We're going to kick things off with a pretty surprising contradiction about this cancer. Then we'll get into who's most at risk and cover the really important stuff, the signs for early detection. From there, we'll walk through what a diagnosis actually looks like, explore the team approach to treatment, and wrap up by looking at what life is like after cancer.
All right, first up, a curable contradiction. And this really gets to the heart of why this topic is so important.
Okay, so on one hand, you've got this pretty stark fact. For guys between 15 and 35, this is the most common cancer they might face. I mean, that's a statistic that's designed to get your attention, and frankly, that should.
But then you've got this quote that just completely flips the script. Testicular cancer is also the most curable solid neoplasm. Now, neoplasm is just a fancy word for tumor or mass. So what this is really saying is that it's the most treatable cancer that forms a solid lump. And that is an incredibly powerful message of hope.
Now, to put all this into perspective, right, testicular cancer only makes up about 1 to 2% of all malignant tumors in men. So yeah, it's the most common for that 15 to 35 age group, but it's still pretty rare overall. The takeaway here, the crucial point, is that this is something we know how to fight. We've gotten really good at treating it.
Okay, so let's move into understanding the risk factors. We're going to look at what this thing actually is and who might be a bit more susceptible.
So to really get a handle on this cancer, you have to know where it starts. And as you can see here, over 90% of cases are what we call germ cell tumors.
So what are those? Well, simply put, they're cancers that start in the very cells that produce sperm. And they're usually broken down into two main types. You've got seminomas, which tend to grow a little slower and stay put, and then you have non-seminomas, which can grow more quickly. And, figuring out which one it is, that's absolutely key to getting the right treatment plan.
So who's most at risk here? Well, research points to a few key things. The big one is something called cryptorchidism, which is just the medical term for when one or both testicles don't descend properly before birth. That really increases the risk. But there are other factors too, like testicular atrophy, that's a shrinkage of the testicles, a history of trauma to the area, some chromosomal abnormalities, and even exposure to estrogen while in the womb.
Okay, this next section, honestly, this is probably the most important part of this whole explainer because this is about what you can do. Let's talk about the signs and what early detection looks like.
Listen up, because this is the #1 thing to remember. The most common sign of testicular cancer is a lump or swelling that is painless. I think a lot of us assume that cancer has to hurt, right? But with this one, that's just not the case, a lot of the time. The fact that it doesn't hurt doesn't mean it's not a problem.
Now, while a painless lump is the most common sign, there are a few other things to be on the lookout for. You might feel a dull ache or a kind of heaviness down in the lower abdomen or scrotum. In about 10% of cases, there can be some pretty sharp pain. And in rare situations, if the cancer has spread, you might see symptoms like a backache that just won't quit or a persistent cough. Oh, and another kind of strange sign can be something called gynecomastia, which is breast enlargement, and that's all due to hormonal changes.
And this quote just nails the main takeaway. I'm actually going to say it again because it is so important. Enlargement of the testis without pain is a significant diagnostic finding. If you notice a change, a lump, any kind of swelling, even if it doesn't hurt, that is your signal. That's when you go get it checked out.
So, what happens next? Let's say you've found something and you've made that doctor's appointment. This section is all about, pulling back the curtain on that process, so you know exactly what to expect. No surprises. A doctor is trained to look for very specific clues. A lump that they're worried about is typically solid, it's firm, and it's inside the testicle itself. Now, that's very different from other common issues, like infections or cysts, which are usually painful, feel a bit softer, or are on the outside of the actual testicle. This comparison helps them narrow things down really quickly.
The path to diagnosis is actually a very clear step-by-step process. It all starts with a physical exam. That's followed by a scrotal ultrasound to get a good, clear picture of what's going on. After that, they'll likely do blood tests to look for what are called tumor markers. These are specific proteins that can be elevated when this type of cancer is present. And finally, they might use imaging like a CT scan or an X-ray to see if it's spread anywhere. See? It's a methodical investigation, not chaos.
And that brings us to the treatment. This is where that message of hope we started with really comes to life. The source material calls it a model for how to treat cancer, and it's all about a team approach. The key phrase here is multimodal therapy. Sounds complex,
But all it means is that it's not just one single treatment. It's a strategic combo of different methods, all working together, and it's tailored specifically to you and the type of cancer you have.
And here they are, the three main pillars of that therapy. You've got surgery, chemotherapy, and radiotherapy. Now, depending on the cancer's type and how advanced it is, your medical team will use one, two, or maybe all three of these incredibly effective tools. They all work together to get rid of the disease.
Okay, so the main surgery is called a radical orchidectomy. It sounds intense, but in simple terms, it's the removal of the affected testicle. It's done through a small incision up in the groin, not on the scrotum itself. And this procedure does two critical things at once. First, it gets the main tumor out, and second, it gives the doctors the tissue they need to confirm the exact type of cancer, which then guides the rest of the treatment plan.
And that brings us to our final section, and it's a really important one. It's all about looking toward the horizon and understanding what life looks like after cancer. Look, a full, healthy life after treatment isn't just the possibility, it's the expectation. To make sure that happens, there are a few key things to think about. Sperm banking is often recommended before treatment starts, just to preserve fertility options for the future. It's also really important to know that removing one testicle, it usually has zero impact on your sex drive or virility. And moving forward, regular follow-up appointments and continuing to do testicular self-exams are just part of staying on top of your long-term health.
So we're going to end on this question. If this cancer is this common in young men and it's this curable, one of the biggest success stories in medicine, then why are we talking about it more? Why does it still feel kind of taboo? It's a question worth asking, and more importantly, it's a conversation worth starting.